Our next podcast will explore the unholy alliance between diabetes and COVID-19. The COVID pandemic has put a spotlight on the high burden of NCDs like diabetes that are present in African countries, their neglect, and the need for delivering health services in an integrated manner. Diabetes and uncontrolled hyperglycemia enhances the severity of COVID-19, making it more likely for a COVID patient to require hospitalization and for a longer period of time.
If you have diabetes, it's associated with severe COVID. The risk is triple to have severe COVID if you have diabetes, and the same holds true for both type 1 and type 2 diabetes.
Africa will not be getting vaccines until 2023, and until then, our best option as countries is to deploy public health interventions to maximum effect. This means timely prevention of non-communicable diseases like diabetes and cancer and other illnesses that are affecting African population in order to keep the burden on health systems minimal. The current structure of Africa's health systems, which have been built to provide services for single diseases, simply no longer makes sense in the face of the double burden that is facing African countries today.
Poor glycemic control has always been associated with severity of infections.
We know that the burden of non-infectious diseases is very high, but we don't know the magnitude of the problem because African countries have not systematically collected data on the NCD burden and how it affects individual productivity, as well as the sustainable development of African economies. We do, however, have estimates of the regional prevalence of diabetes in African countries, which is estimated at 3.1% and amounts to 15.9 million adults living with diabetes across the African continent. Diabetes can be treated, controlled, and managed to prevent complications, but this is only possible if people have access to diagnosis, self-management, education, and affordable treatment.
So make it easier for the individual to be tested for non-communicable diseases. So even if they go for the COVID vaccine, offer them a test for diabetes, hypertension, and so forth. But we also unfortunately see how individuals who require insulin from the get-go with COVID do not have access to that, even in urban situations where people are treated with oral anti-hyperglycemic agents, despite having glucose values that require immediate initiation of insulin.
The tragedy in all of this is that a large fraction of diabetes is preventable through lifestyle measures like the choice of food people eat and physical activity. What we do know is that the African continent has the greatest proportion of people with undiagnosed diabetes, and global projections show that Africa will experience the biggest future increases in the burden of diabetes of up to 156% by 2045. Whilst the reasons for the neglect are complex, to a large extent, this neglect has a lot to do with the fact that national health development policies of most African countries have been heavily influenced by the interest of development partners who are generally more concerned with protecting their borders from the health security threat of infectious diseases that are coming out of Africa. So how does the negative influence of these external policies manifest themselves? Well, to start with, they are the main reason why African health systems have been structured in a vertical manner in which they provide care for single diseases to the neglect of other health problems affecting African populations. These policies also cause harm by compelling African governments to put resources away from the problems affecting large numbers of African populations in order to support and enhance the success of donor programs. They also often require that African governments focus their attention on specific problems of greater concern to donors. And these are often transmissible diseases and leaves little attention on non-transmissible diseases like diabetes and cancer. The result of this is that health problems affecting large segments of African populations across many countries have simply been neglected for decades and continue to be neglected today. African countries need to re-engineer health systems so that they can deliver health services in an integrated manner at the primary care level so that they're able to reach the majority of African people. Unless African countries change the way they think about service provision for non-communicable diseases as well as infectious diseases, and consider this an urgent national health priority, starting by putting more resources towards developing specific actions to prevent, to detect, treat, and care for people with diabetes, and to scale up those interventions, African economies will continue to suffer the consequences of inadequate health systems. Population health needs that are not transmissible will not be met and will continue not to be met until African governments start to take targeted measures to prevent, diagnose, and treat people with non-transmissible health problems. NCD control would help to mitigate against hospitalization of COVID patients, and this is why African health systems that do not provide effective care for non-communicable diseases simply make no sense if our objective is to improve outcomes for African people.